Hello, I'm going to be doing the NG tube insertion skills video today. I am wearing the school uniform color along with the school ID badge. We're going to go ahead and go into the patient's room. Knock, knock, knock. I'm going to close the door behind us for patient privacy. We're going to go ahead and perform hand hygiene. Hi, my name is Tanya. I'm going to be your nurse today. Can I please verify your name and birthday? Patient's name is Mr. Manny White. His birthday is January 16, 1988. I go ahead and confirm with his ID band and the information does match. So Mr. Manny, the doctor has gone ahead and placed an order for an NG tube insertion. Seems like you've been aspirating on your food and it has not been going down to your stomach. So the doctor has placed an order for us to do an NG tube insertion. We're going to go ahead and bring your head up high. So we're placing the patient in a high pelvic position. The patient tolerates it well. I did bring all my supplies with me. So we have a pair of gloves. We have the NG tube. I have a napkin to place on the patient's chest. I have the 20 to 60 cc syringe for aspiration. I have the lubricating jelly along with an emesis bin, a cup of water with a straw for the patient to drink while we're doing the insertion. All right, Mr. Manny, so we're gonna go ahead and check your nostrils. Make sure there isn't any obstructions and see which side is best for us to insert the tube in, okay? So with the pen light, we check each nostril. I'm gonna have you hyperextend your head so I can look inside the nostrils. Okay, so there's no obstruction. Oral mucosa looks pink and moist. No deviated septums that I can see, so everything looks good. Now what we're gonna do is we're gonna go ahead and cover a nostril and I'm gonna have you blow air out on the opposite end. We're gonna start with the left side. Perfect. We're gonna start with the right side. Perfect. All right, so now what we are gonna do is I'm gonna go ahead and put my gloves on before I start the procedure. What's gonna happen is we're gonna go ahead and insert the tube. While I'm inserting the tube, I am gonna have you hyperextend your neck. Once the tube is down to the back of your throat, you are gonna feel your gag reflex activate. So once you feel that, I'm gonna have you tilt your head forward and you're gonna take sips of water. As you're taking those sips of water, we're gonna go ahead and continue to insert the tube little by little. If at any point in time you need a break, just go ahead and raise your hand and we'll pause for a bit and then we'll go ahead and continue after, okay, once you're ready. All right, sir, so first we're gonna go ahead and place this towel on your chest. And we're gonna go ahead and check or measure the NG tube. I do have pre-cut tape here in the corner of the table. So we're gonna measure from the tip of the nose to the tip of the earlobe down to the xiphoid process. The tube has been sitting in warm water for flexibility. So tip of the nose, tip of the earlobe, down to the xiphoid process. So we're looking at about 55. We're gonna go ahead and mark the number 55. All right, so next we are going to lubricate the tip of the tube so that it can glide in easier. All right, sir. So here we go. I'm gonna have you hyperextend your neck and we're gonna go ahead and insert the tube. Okay, ready? All right. So with the neck hyperextended, we're inserting. Once you feel that gag reflex, let me know and I'll have you take some sips of water. All right, so we have gone to the back of the throat. Patient is gonna tilt the head forward. Take some sips of water. As the patient takes the sips of water, we are introducing the tube little by little. Patient continues to take the sips of water. And we continue to introduce the tube. All right, sir, you're doing great. Very good. We're almost there. All right, so we've gotten to our mark. Once we have gotten to our mark, we're going to go ahead and secure the tube with the tape. Okay, once that tape is secured, we're going to go ahead and wait for X-ray to come in and check placement for us. Meanwhile, we wait. We are going to go ahead and aspirate about 10 cc's of stomach contents to test it with our pH strip and the bottle. So we're going to unclamp it. And with the adapter, we're going to go ahead and aspirate that 10 cc. All right. Go ahead and clamp it. So we're going to pour the content out. We're going to put some of the content on the strip. We're going to measure it against the bottle, and the pH is normal pH should be from 3.5 to 5, and that's what we have here, which means we did get stomach content. Okay, so the patient comes back from the X-ray. The X-ray shows that the placement is correct, so we are going to go ahead and just make sure that the tube is securely taped on the patient's nose. We're going to do it with a different type of tape. And we're going to fixate it on the patient's nose. And then we're going to go ahead and pin the tube to the patient's gown. We're going to put the tube to the suction on the wall, and we're going to check back every 2 hours to make sure that it's suctioning properly. Okay, we're going to go ahead and remove all the trash, get rid of everything, toss it out in its appropriate location. And then we're going to do some patient education. Okay, Mr. Manny, it's important for you not to lower the head of the bed less than 45 degrees because we want to prevent any risk of aspiration. We're going to go ahead and place the bed to its lowest position. Before we leave, we ask the patient if they have any questions. Patient doesn't have any questions for me at this time, so I'm going to go ahead and remove my gloves. Perform hand hygiene, and now we're going to go ahead and document the color of the contents that we aspirated, the characteristics of the contents. We're going to go ahead and document the amount of the drainage, the measurement of the G-tube, and how the patient tolerated the procedure. And that concludes the end of my NG tube skills video. Thank you.